what is PCOS and how do we diagnose PCOS?
Okay, so let's begin with the basics. So PCOS is polycystic ovarian syndrome, which initially it used to be called as PCOD, polycystic ovarian disease. Now we prefer to call it a syndrome and not a disease. So PCOD and PCOS is the same. And I'm saying this because we get this question a lot, that what is the difference between PCOD and PCOS, and in fact some some websites will even state the differences between PCOS and PCOD, but it's essentially the same. So what it is the basic problem, what is happening is there is no ovulation, right? And in a normal cycle, one follicle in the ovary gets selected, which goes on to, that follicle goes on to ovulate, which goes on to release an egg. And if it meets a sperm, a pregnancy happens, and obviously periods are stopped. But if it does not, then there is withdrawal of the estrogen and progesterone hormones. And so when the follicle grows is when the hormones rise, which is when the lining of the uterus, the endometrium, increases in size. And once there is no pregnancy, this hormones drop and there's a withdrawal, which leads to shedding of the endometrium, which is what is our period. So in PCOS, what happens is this one follicle does not grow and ovulate. Small follicles grow, and there's no one follicle which goes on to ovulate, so which is why ovulation does not happen. And because this one follicle is not being selected and getting ovulation, the periods are not regular, right? So there's an explanation behind every kind of symptom that happens in PCOS. So the terminology polycystic ovarian syndrome is the ovary looks polycystic, like these small follicles that grow make the ovary look polycystic, appear polycystic. It does not really mean that the ovary has cysts, right? Like an ovarian cyst is different and polycystic ovaries is different. You can't really remove each cyst, or you don't even have to remove each cyst. It's basically the follicles in the ovary, right? So, and you also said how it is diagnosed. How it is diagnosed is there are three things that are central for PCOS. One is the ovaries appear polycystic, which we will know on a sonography. So that is one. Second is irregular periods, delayed, most often delayed periods. So irregular periods is another. And why all of this happens is because there is the hormones that are released by the pituitary. So the pituitary, basically the hypothalamus, the pituitary, and the ovaries are like an axis which kind of regulates all the hormones in the body and our menstrual cycle. In PCOS, the hormone from the pituitary, which is the LH, is high. So because of this high LH, it also leads to excess of male hormone, like testosterone, which we commonly hear. So there is excess of male hormone, which is also androgens, testosterone. So because of this excess of androgens, there is androgenic symptoms like acne, excessive facial hair, around the chest, at areas where you would not want excessive hair. And there is also thinning of hair, like hair fall. So all of this is because of the excess androgens. So how you diagnose PCOS is there should be two out of these three things that I mentioned. One is the ovaries are regular periods, and either evidence of excess androgens, which will be by the effect of symptoms, which I just mentioned, or sometimes there may not be any symptoms, but if you check the hormones, like if you do a free testosterone, it will be high. So two out of these three things means that somebody is polycystic. Why it is important is because just by seeing polycystic ovaries on a sonography, you can't diagnose somebody as PCOS, which we do see a lot. Like, a patient will come and say that, doctor, I have PCOS. And you're going to be like, how do you know you have PCOS? Just because your sonography says you have PCOS doesn't mean that you have PCOS. You need to
Exactly.
have the other symptoms as well.
Is poor lifestyle also related to PCOS somehow?
Absolutely. So what happens is because of the excess of LH, there's also excess of insulin. It's not just an hormonal problem, it's also a metabolic condition, right? So, because of this excess insulin, there often is insulin resistance. We see insulin resistance wherein uh, the the glucose levels will despite the presence of insulin. So the pancreas try to secrete more of insulin, right? So this is so excess of fasting insulin or even the HOMA IR, the index suggests insulin resistance, which we see in women with PCOS, especially women with obese PCOS. So and usually the weight of these women correlates with how delayed their periods is. Just often losing just a few kilos just sets the whole hormonal imbalance right, and the periods start getting regular, the cycles start becoming ovulatory. But of course this is for women who are obese and PCOS, but we also have a subset where there is lean PCOS, which is even harder to deal with, because lean PCO women don't need to lose weight, they need to be handled in different ways. So definitely,
Uh,
lifestyle factors do play an important role in dealing with PCOS.
if hair loss, and how is hair loss linked to PCOS?
So because of the excess testosterone, the excess of the testosterone will be converted into a more potent hormone, which is dihydrotestosterone. And if you see, a lot of these anti-hair fall products will have DHT inhibitors. So essentially, the dihydrotestosterone is what is causing all the problems of hair fall in PCOS. So what we see in PCOS is a sort of androgenic alopecia, which is alopecia, because alopecia is hair because of the excess of the testosterone and dihydrotestosterone. So the kind of hair loss that we will see is, uh, you know, um, frontal and loss from the temporal, the temples, and the hair parting will increase, and there may be a receding hairline. And um, it's also it's also important to note that hair loss because of this androgenic alopecia is almost, once the follicle is lost, it's difficult to regrow it. It's almost like an irreversible kind of hair loss. So this, when it is detected, it's often detected late, and as you said, women with PCOS don't are not aware that it can cause hair loss as well. So detecting this earlier is important, and dealing with it at a point where it can be treated and reversed is very important, because it's often irreversible.
What is it that we can do to manage this kind of hair loss?
So, the best, in fact, so there are various ways that there are various drugs that can be given for reducing the total androgens in the body, the total testosterone, free testosterone, and the DHT. So, commonly when the oral contraceptive pills that we prescribe, they essentially work to reduce the testosterone, right? They reduce the androgens. So if there is no, if that excess of androgens is not happening, then the hair loss will not happen. So oral contraceptives is one great way of dealing with hair loss because of PCOS. Um, it, Often, these newer combinations have the sort of anti-androgenic progesterones. So an oral contraceptive pill is estrogen plus progesterone, right? So the progesterone component in this oral contraceptive pill, it's the name of the drug is drosperinone. So this has an anti-androgenic effect as well. So it sort of amplifies the anti um, it amplifies the reduction of the male hormone in the female. So that's one thing that can help. Um, other thing that can help is just medication that can reduce the anti-androgens basically. So there are various drugs like aldactone, which is essentially spironolactone. Then there is finasteride and dutasteride. This basically it prevents the conversion of testosterone to dihydrotestosterone, right? But these medications, all of these in fact are highly teratogenic, so a woman cannot get pregnant while taking these medication. So if somebody is on these anti-androgenic drugs like spironolactone, aldactone, finasteride, dutasteride, they need to be on a very strong contraceptive as well. But yeah, these medications can help in preventing, in curing, in basically in reducing the excess of the androgens and helping stall that process of hair loss. Plus, we know of topical minoxidil, which is available, which is like minoxidil is it's a kind of a vasodilator. So basically what it does is when you put it on your scalp, it increases the scalp. So by that effect, it improves the health of the scalp, and it reduces the hair fall. So minoxidil is also something that can be used, but it needs to be used with caution, especially in because we're not talking of men here, but sometimes it can cause problems in the sperm motility in men. And of course, apart from these drugs that I mentioned, a good healthy diet like eating the rainbow, including all antioxidants in your diet, good fruits, food, nuts, legumes, these high colored fruits. Also in make sure you're including fatty acids, healthy fats like I mentioned, nuts and fish. Also fish has very healthy fatty acid, omega-3 fatty acids, and also certain supplements like zinc, biotin, and even other antioxidants like vitamin C, vitamin E have been. And of course, protein is the most important, because most of our hair is protein. If you see the actual content of the hair, it's made up of keratin, which is protein. So you have adequate amount of protein, which is about a gram per kg per day, which for a 60-year-old female is 60 grams of protein a day. Now our general Indian diet does not include this 60 grams at all. So it needs to be supplemented in the form of either being mindful of maybe including eggs, fish, chicken, lean meat in your diet, or if you're a vegetarian, then pulses and uh, paneer, tofu, and things like that. You can also opt for a protein supplement like a whey-based protein supplement or a plant-based protein supplement.
How safe is topical minoxidil for PCOS-induced hair loss?
So topical minoxidil is quite safe because it's used just topically, so there's not going to be much of absorption of the active ingredient in the bloodstream, but it will act on the scalp where it is applied locally. The only drawback is sometimes it may not suit everyone using it, and also it needs to be applied every day. It is effective only if you apply it every day, and it is effective only until you apply it. The minute you stop applying it, the effect is lost. So it has to have that compliance of applying it every day. But like I said, it may not suit somebody. It may cause an itchy scalp sometimes, which prevents use of minoxidil often. So, but it's pretty safe to use minoxidil, I would say.
What kind of foods is supposed to be avoided?
Things to avoid: any refined carbohydrate, sugar, saturated fats. All of this will sort of lead the whole metabolic condition to be sort of deranged. So those things should be avoided. But other than that, and of course, you can have whole grains, but because insulin mainly, because carbohydrates mainly are responsible for spiking our glucose levels and hence also insulin levels. Um, Restricting your carbohydrates to an extent. I'm not saying don't have carbohydrates at all, but if you're trying to lose weight in PCOS, and if you're trying, or even if you're trying to maintain a healthy weight, limiting your carbohydrates and ensuring good amount of protein and healthy fats in your diet is helpful. And of course, if you have insulin resistance, you need to restrict carbohydrates, and refined carbs like maida and sugar is something you should completely avoid. So one thing that we didn't touch upon in PCOS was that it can cause difficulty in trying to conceive, and this is because ovulation does not happen in PCOS. But it's very easy to address. All that's needed is giving is ovulation induction, wherein we just give certain tablets, and we do serial sonographies um, to see if a follicle is growing, and then we go on to see if the follicle ruptures, and if the follicle does not rupture, we often give a trigger also, which is the HCG trigger, which helps in the follicle to rupture. So and this we time it with we it's sort of ovulation induction with timed intercourse. So in PCO women, they often don't know when ovulation is happening because their periods are so delayed, right? May not. So ovulation induction really works, and it's so many women are very apprehensive about the fact that they are not getting regular periods, and getting pregnant for them would be difficult, but it's not really difficult. You just need to go see a fertility specialist, and they will definitely be able to help you out with it. Thank you for having me, and yeah, I'm glad that this was informative for the people who watched it.